Hi everybody, it's Dara, and I am here with Dr. Gamagami. I pronounced it correctly?
Correct. Yeah.
Do you know who this is? This is a teacher of Dr. Sadeghi. Dr. Sadeghi said, when you meet him, make sure you have your camera because he has a lot to say, certainly for women and breast health. He's the author. Thank you for doing this with me, by the way.
My pleasure.
He's the author of a book for doctors, and then he's also, this is the Atlas of Mammography, New Early Signs in Breast Cancer. This is going to be tough for us to read, but this is a book that we can read, and you can find it on Amazon. Fight New Ways, Breast Cancer. So we're here to talk about breast health.
Yes.
Yes.
Before starting to talk about this book, I must emphasize one important thing. And that is that now these books are in reality the essence of my 55 years of experience in the breast cancer. I started my medical school in Paris in France, and I was assigned in the Curie Institute from the day one in the medical school. So that's the first day of my visit to this hospital was seeing the patient with the breast cancer. So therefore I know that how the cancer behave, was all the treatments. Another important thing I must say that
Yes, please tell us about you and
in France at that time, that means about 60 to 70 years ago, in 1963 already, the French doctor needed really a specialty of the breast because the breast cancer was so vast that needed a specialist for that. And they called that breast specialist the senologist. Senos in Latin means breast.
Senosa.
So therefore, who was really a specialist? Mainly a radiologist who could read mammography, who could do ultrasound. Even at that time, we were doing all the scan with the radioisotope. Now, what's this specialty? This specialty, the patient comes directly to that doctor, like you go directly to the eye doctor, you go directly to the gynecologist for the female organs. So that's direct, and that's very economic for the patient because the patient sees only one time a doctor, he does everything, and then if it is needed, then sent to the surgery because they're all to the oncologist. So that's how when I came here to America about 40 years ago, I started the same type of practice in medicine. That means the patient came directly to me, I examined the patient, I did mammography, I did ultrasound, all necessary things. I did a biopsy.
Wait, hold on. Mammography,
ultrasound.
You did the biopsies as well.
The biopsy, yes.
So
and even in the beginning, there were a lot of doctors that criticized me, and they said, "You are radiologists. Why did you touch our patients?" You know. And unfortunately, I must say, American College of Radiology for years and years tried to put the title of a physician for the radiologist because the radiologist in America was not known as a physician. And the physician was somebody that examined the patient, see the patient. And radiologists did not see the patient. And that's why they didn't know that some people, they thought that repair the television or the radio, thing like that. Yes, that's the reality. Wow. Now, with all the advancement in the technology that mammography, ultrasound, MRI, PET scan, etc., that's really a new field. A new field, but it's still the radiologist is not seen as a second citizen. Okay, so therefore, but in 60 years in France was not the case. The radiologist who was a specialist in that was considered
and they were
a
allowed
physician.
to perform the biopsy.
Biopsy.
Were you allowed to do that here for all that time?
No, they allow this because in America, when you come here or for the American graduate, they give a title of the physician and surgeon. So they can do everything.
Okay.
Unless there is a problem, they go to the court, they said, okay, you are not surgeon. Why you have done that?
Okay. Wow.
But still,
What was your title?
we can do everything. But if you prove that you have done a lot of things and the good results, so
really?
you are covered. You
Okay.
know, that's just a minor obstacle. But anyhow, so in you have a question?
Well, yes, you're retired now, but for many years you practiced doing just breasts.
Just the breast. All the, not for 50 years, only breast. So I tell you how was my practice, as is written in this book.
Okay, I'm gonna
how
read
was
it.
Yes, how was my practice? The patient came today because I was working in the hospital. The patient came to see me first because of problem breast. I examined the patient. And then if there was nothing, mammography at the age of, for mammography. Mammography was, everything is okay, examination was okay, mammography is okay, go home. Okay, the patient comes, mammography was suspicious, okay? At that time, ultrasound was not so advanced that we could do it by ultrasound. We do we call that hook wire localization. The area that we saw abnormal on mammography, I put a needle there, okay, and went to the surgery, and the surgeon removed that area biopsy. Today is different. Today, radiologists have a much more sophisticated armament. That means that when there is something abnormal on mammography, they do ultrasound. If there is something that is possible, they put a needle now. Now the biopsy by a radiologist is common.
Really?
But at that time, when we came here, I was criticized for that.
Wow.
Okay? So that means that people, I don't want to tell you they are more advanced, but probably they thought more about women than the other areas. Okay. Now, the one thing that in this book is I emphasize, there are two types, important is treatment of breast cancer. Important as a breast cancer is that there are two types of treatment for breast cancer. Now, how practice here at this time in America? The patient goes to gynecologist, patient go to internist, patient goes eventually to surgeons. And they examine the patient after the age of 40 or 45 or 50. So they said, okay, have a mammography. If a mammography, the radiologist report mammography is okay, patient go home, come back in 1 year. If the mammography shows something abnormal, then radiologists suggest the ultrasound. If he sees in ultrasound something abnormal, they do biopsy with the needle, okay? It's good until here. Now the diagnosis of breast cancer is done. Then the patient sent to surgeon. The surgeon removed that area, either if it is not palpable, localize with the needle, and then go to the operating room. They remove the cancer, And also they make what they call that sentinel lymph node test. That means they remove also from the under armpit lymph node. If the lymph node 2 days or a week later become positive, that means a cancer, then the surgeon usually they go for lymph node dissection, and they make a larger incision, and they remove much more, 10 to 20 lymph node, and they call. And that is after that you have a lymphedema, you have a retraction, and you have the shoulder problem. Anyhow, there are a lot of complications, but it still is done because that's the norm. So, and then if after that a patient sent for the either chemotherapy or radiation therapy. Oh, that's a norm now. And that's also a type of the treatment that we have learned empirically by experience. Now, therefore, there is two type now procedure. Either this empirical or new modern way of treat the breast cancer. The mother of the breast cancer is a little bit different because the classical one, which is still done everywhere in the whole world, because the other one is quite new. Maybe they don't have access to that procedure, or they don't know yet. As I said, because in medicine, unfortunately, takes
A long time.
years to change the mentality, to change the procedure. When you are
Right.
used to do something for 30 years, it's very hard to
Right.
change the way, and you don't accept that, and you criticize that, etc. So therefore, what's that? This one is a classical one. The other one is that once you do the patient mammography is abnormal and ultrasound proved to be cancer, right away you request a genetic test. We call that should be, when we said the genetic test, the people think that is about from the father-mother genetic. Excuse me. But in reality, that's not the way. That's a genomic. That means we examine the gene of the cancer cells.
Ah, okay.
That's a different.
Yeah.
The other one, you can take. If you want to see the cancer is from genetic, from the parents, you take from the saliva,
Wow.
just touch that saliva and examine, and they show, yes, there is a gene that we see from father or mother
Wow.
transferred to the patient, and this gene is predisposed to cancer. It's not yet cancer, but predisposed. 75–80% of the case get breast cancer. So therefore, that's should be distinguished between the genomic test and the genetic test.
Okay.
Genetic. So when we remove that specimen by ultrasound, or sometimes we cannot see by ultrasound, then we go for the MRI, under the control MRI. All these procedures are very complicated, but needs a lot of talk about that, but I make a resume of everything here. Very.
Thank you.
Yes. So now we put the needle and the cancer is there. We request genomic test. There are multiple genomic tests that tell you this patient is either predisposed to recurrence of cancer or not. And one of them that has been proved, and now in all Europe they do that, this is a genomic test called MammoPrint. When you send your slide or your fresh or your specimen to the laboratory for this genomic test, 10 days after they send you the response, they respond you that this is a low risk. That means the chance of getting back the breast cancer is 10% maximum.
Okay.
Or high risk. If there is a high risk, the risk is about 38 to 40%. Now it's very important, because when we see that the patient is a low risk, okay, we remove only the cancer. We don't go to the lymph node dissection, okay? That's very important,
Yeah.
because the complication
Not fun.
not really agreeable. So therefore, this test should be done. And in addition, when there is a low risk, you don't need chemotherapy. Chemotherapy not only very expensive, it's about $40,000.
Wow.
Not only expensive, but it's devastating for the patient.
Yeah.
There is no
Right.
cancer treatment, chemotherapy, without side effects. The side effects are numerous.
Yeah.
Okay, now this test, genomic test, shows you many things. First of all, you said this cancer is sensitive to hormone. If it's sensitive to hormone, again, the treatment changes. That means you need the things, the medication, we call that hormone therapy, but in reality, that's not a good name, because that's not hormone therapy. It's anti-hormone therapy. We give the medication against the hormone,
Okay.
not the hormone therapy, but
Right.
anyway, it doesn't matter. That's a big issue. So therefore, it shows us there's a hormone sensitive hormone. We have a estrogen, we have a progesterone. If they are positive, then we give a medication. There are medication after menopause. There are multiple different type. There is Arimidex and before menopause, other type of the anti-androgen and anti-hormone therapy. So therefore, and then the patient does not need to be sent for the whole body MRI, for PET scan, thing like that. These are all very expensive and not without side effects, okay? So therefore, we have, but this type of the treatment that I explained to you is not a generalized. Little by little, first they didn't believe that this test is accurate. But lately, about 6 months ago, the result in whole Europe, they came and they saw that the 40% of patient that was going to have all the other things like a lymph node dissection, etc. They don't need that.
Wow.
So
Wow,
the
that's
40%
amazing.
is economically
huge.
very huge. So therefore, that's in resume, I can say that there are two types of treatment. One is a modern, which is not classical yet, but patients should know that, and
Yes.
they can request that, because finally
Wow.
this decision is upon the patients. Patient decide, oh, I want this one, I don't want that one, why don't do that things? So you have to speak out and request this test, which, knowing that, and in this book is written how should be done, and what's the side effects of all the treatment, what's the side effect of the chemotherapy, what's the side of the radiation therapy, lymph node dissection. All this is written in this book, and this is really a collection of my personal experience and the collection of the modern experience in the breast cancer.
Thank you so much. I'm going to read this book and I'm going to report back.
One other thing that I found.
Yeah, anything you want to tell us.
One another thing that I found that for the bra. You know, long time ago, it has been reported that in England that the bra can cause breast cancer, underwire bra. And personally, I did not believe that in the beginning. But little by little, when the patient came, and I saw a lot of abrasion, a lot of eczema, a lot of the wound underneath because of the big breast or the pendulum breast. So there was a line, red line. And then I said, okay, that's because of that. It's not important. Then I noticed that that was the first patient that she had a bilateral erosion underneath, like eczema, like something like eczema.
Yeah.
And she asked me, how can I treat that? I said, well, that's see a dermatologist to see us. And she saw dermatologists, and they said, put some cream and maybe it was sufficient for that. But next year, when she came to us again, I saw this erosion is worse. And then I said, okay, at this time we have to do a biopsy to see what's that, because that with the cream did not heal. So when we did the biopsy, on both sides was a cancer.
Wow.
At that time,
Wow.
I woke up,
Yeah.
and I said, so that's nothing there that can cause it. That's only the underwire bra, because that's by erosion. And then there was a publication later on that any infection can cause a cancer infection. So that was a lesion infected, you know, and with the infection. But this type infection would not be healed by antibiotic or like the cream, because that was a cancer.
Yeah.
And we didn't know that was a cancer.
So the lesion caused the cancer.
The lesion, the erosion, the friction,
Wow.
and that's rubbing all the time, you know, and then first you will see some redness, and after you may have some erosion, and after that you may have cancer. You may have cancer. So after that, when then every patient came to me with the underwire bra. I examined, because sometimes the patient did not know what's going underneath because she didn't feel anything.
Yeah.
Okay, so I examined the patient. If I saw something there, I said, change your bra without underwire. And then I proved that I saw many cancer just on the line.
The line.
On the line of the pressure.
So it's true. It seems to be true. And so, I mean, in this day and age, there's so many bra companies that make them without underwire.
Yes.
So many.
Yeah, that's
there's many. Most women hopefully many women know that we're not supposed to be wearing underwire bras. Are we supposed to be getting mammograms? How do you feel about?
Well, mammography is really, at this time, the dose, they try to, we don't know exactly what the dose can cause cancer in general, because of the X-ray. What makes the X-ray? X-ray goes to the cells and destroy the gene, and maybe by destruction of the genes, what's the gene? The genes are the chemical substances. Maybe by destruction, because the cancer wants, the tissue or the cells wants to repair itself, maybe by repairing wrong ways, because they're all substance in the breast that we have, everybody has. We have the substance, a precancerous substance, precancerous. And this precancerous substance later may transform, we call that mutation, by mutation transfer to cancer. Maybe when the cells has damage, it wants to repair, it goes the wrong way to repair it. It repaired by wrong gene. And wrong gene is the precancerous gene, not the normal gene. So therefore, that's a possibility that can cause, but we don't know what's the dose. By extrapolation, that they have the atomic bomb in Hiroshima, etc., they came to the conclusion maybe 200 rats at that time, they said, and when you do mammography, practically, if you have for 10 years mammography on both sides,
every day?
Not every day.
But
once a year, every day.
For 10 years could be problematic.
Probably problematic.
So how do you find out if you have cancer if you're not getting the mammographies?
Okay, if you don't have a mammography, the most important is that MRI. Even if one day, the country becomes so rich and the voice is heard, instead of mammography, do MRI.
Okay, because they're more expensive to do MRI.
Because more expensive, more complicated, and therefore...
but less traumatic to the body?
Yeah, that's practically no, at this time. The only thing is that sometimes we inject a material.
Oh.
This material sometimes is not good for the kidney.
Okay.
That's the only side effect. And that's why we have asked the patient, if the patient has a calculus or the stone in the kidney or the kidney disease, don't do that.
Right.
We don't do that.
Right.
And then there are other techniques that I don't suggest at this time. Then there is a PET scan. Okay, PET scan naturally is this radioactive, again, material that we inject. But at this time, the only thing that we know is the safest one is the MRI. Yes.
All right.
Okay.
That's an amazing amount of such interesting information. I thank you.
Welcome.
I think what's going to happen is that I'm going to have questions. I know you guys are going to have questions. I'm going to write them all down, and then maybe Dr. Gamagami will be so gracious again I can come back and answer questions. This is the start of a beautiful conversation. We're going to drop our wireless bras to the floor. But it's good to wear bras, right?
Yeah, sure.
Okay.
Cosmetic is important for women. You know,
Okay.
that's I do not ban it totally.
Right, and but someone told me that it's really important for breast health to wear bras. Is that true?
For what?
Important for breast health to wear a bra. Is that true?
Health, I don't see.
No.
That's because bra we didn't have for a million of years, you know. So there are people who are not all the unhealthy for that.
Excuse me while I take mine off. No, I thank you so much. Dr. Sadeghi said, Dara, grab your camera. I'm so glad I did. He is Dr. Sadeghi's teacher. He said, please tell everyone he's my teacher, and I'm so honored to be able to have this time with you.
The only thing that I want to suggest, I read the book of Dr. Sadeghi many times, and I suggest to everybody, especially people who have a breast cancer. Breast cancer is the cause of the psychological distress, psychological diseases, depression, fear of dying, and anxiety permanently. The cancer is gone, but sequela, but the scar is still there, and the scar is a mental disease. And I suggest the people to read the book and learn how to handle the problems, So that's a very important thing. And myself, I'm convinced, and unfortunately, when I read the book was when I was retired. Otherwise, in my office, I would have put this book and I
Yeah.
would have given free to everybody.
Yeah.
Everybody.
So you're of the same belief. One of my favorite quotes from Dr. Sadeghi is our biography dictates our biology. That what's going on in our lives, in our minds, emotionally, will show up as dis-ease.
Exactly, exactly. Yes.
Can you
Yeah.
come back and start practicing? Please? Why
No,
do you retire? You have everything it takes that we
No,
need.
that's I retired because I wanted to
Right,
really
right.
write the book.
He
This-
wrote the book,
Yeah,
and now you
but
can come back
despite-
because you wrote the book.
Despite the low volume of this book, as you see, it's not really
No,
like
it's-
this one.
It's readable.
Yeah,
I
yeah.
can't read this one.
Yeah.
He showed me. I'm like, oh, that's your book?
Yeah.
Oh, it's very technical. It's very technical.
Yeah.
We
And
have an
on
expert
that one,
on her.
this, as long, because on that one, I don't want to brag about that, but I
You can.
found, no, I found the many, many earliest sign of breast cancer on mammography that had never been reported on the literature. And the reason was very simple. Every patient come to see me with their mammography and with the cancer, or we did the diagnosis of cancer on mammography, because as a large stellate image is not needed really to put the needle, exception maybe a scar, but in general that's a cancer. So I asked them to bring their previous mammography for many years. For instance, this one, as you can see here, this is 81, 83, 84, 85,
The years of
86,
progression
the
of this
progression.
woman's breast.
And the cancer was there already at 82. 4 years later, the cancer was discovered. And the reason, because it was not known at this time, these images for the radiologist to interpret, to say this is something suspicious here. So therefore,
Why would they couldn't see that? They couldn't tell?
because that was not reported. They were not taught how to make a
Wow.
diagnosis. There was
Wow.
not. The book is for that. The generation and generation.
This
is-
book is for the doctors so they can diagnose the cancer, so they can see it. Early detection. Early detection.
Correct. Early
Yeah.
detection by mammography.
Yeah.
And then this is because if a cancer really 4 years is not diagnosed, is the prognostic is not as good as if it was detected 4 years earlier.
So what if somebody doesn't want to get a mammogram or an MRI, or will it show up in some other way? Can you tell if you have
Okay,
breast cancer?
now the thing is that if important is that, suppose that I have the patient that 5 centimeter breast cancer, okay? And it's written in this book,
Okay.
5 centimeter. 5 centimeter cancer, what they do usually, they do mastectomy, okay?
Yeah.
And after that, absolutely they do radiation therapy. Absolutely they do chemotherapy, okay? This patient 5 centimeter, I ask mammoprint. Mammoprint says this is low risk. She didn't neither mastectomy nor radiation, just to remove the lesion.
Okay.
See the difference?
Yeah, that's huge.
This is for the patient.
That's huge.
Mastectomy and radiation and chemotherapy, and she did not need
Wow,
none
that's
of them
amazing.
because of the modern technology.
Right.
Modern technology is, I wish that every physician, everybody who's in cancer domain, read
Okay.
this book, and because that's as I said, collection of the data in the literature and my personal experience.
Oh my gosh, thank you so very much. Such a pleasure.
And I said this one, I didn't want to brag about that. As long as the mammography is still done, this book is valuable for radiologists.
It's called the Atlas of Mammography.
Yeah, but that's, yeah.
You can brag. You're entitled. And you can also come back to work, because now you've written your book.
And this is you can see here, that's a lady, the veil, the woman, and that means the veil of science. And that's, you see, that's a...
Devailing the woman and devailing...
Einstein Nobel Gold Medal Prize shows science and veils secrets of nature.
Beautiful. That's a beautiful cover. And so we're gonna have to get mammographies to see, right?
Yep.
Yeah. Unless we're going to get an MRI. Oh, there's pictures in here. Oh my. Okay, yeah, this looks like a good book and very informative, and it's been such a pleasure. I thank you so much. You guys can get this on Amazon.
Amazon
It's
Gamagami.
Fight New Ways, Breast Cancer, Parvis, which means paradise,
Yes.
Gamagami. So I thank Dr. Sadeghi. Everybody's going to get the Clarity Cleanse book. We're going to educate ourselves as far as breast health, and we're going to cheer Dr. Gamagami on for his next book or returning to his practice. Thank you.
Welcome. Have a good day.